First of all, thank you all very much for coming. If I'd known that it was this easy to get this week from Jill, I would now rewind classes a long time ago. This is awesome to see this many people this concerned. I hope this concerned about the health of their spine. I hope that we're here for the right reasons. And there's nobody better that I know to help us think about this than Heather. She's done wonders for, I don't know, 20 more athletes. At some point, me included, I wouldn't be able to squat if it wasn't for her. So we're going to just turn this over to her and let her get at it. But thank you guys so much for coming. Let's give a round of applause.
Okay, so again, thank you all for coming. I really appreciate it. This is a good testament to Kevin for that this CrossFit is such a community. So if it's the wine that got you here, that's good too, I guess. So today we're going to talk about proper body mechanics and spinal health. So first let's talk about what body mechanics actually is. So it's a term used to describe the way that we move throughout our days. It's how we lift, how we carry, how we sleep, how we stand, any movements that we do throughout the day. So ultimately, how many of you have heard of someone, or maybe you have been this person, that you just bent over to pick up a piece of paper and your back went out? Have you guys experienced that? Or had somebody, known somebody? Definitely. So it's not that it was the paper that weighed 1,000 pounds. It's those small micro traumas of using improper ergonomics throughout our days that gradually builds up in order to then let our back go out just with that little piece of paper. Psychologically though, a lot of patients come in and they're like, well, I just picked up a pen on the floor, so I don't know why my back hurts. It's really hard for us not to have a cause and effect relationship. If we trip over a curb, we know we sprained our ankle and it's, we need to ice it and it's swollen and all of that. We know what happens. We fall off a ladder and we have pain, we understand why we have that pain. But with the spinal or the structural pain, a lot of times, because it is that accumulation of those micro traumas, we don't necessarily we can't add it up to one major event, which is really, really tricky. So, principles of the proper body mechanics really are simple, they're just kind of difficult to train our bodies to do. Ultimately, it just takes some time and effort to make them our new norm. So we can incorporate them, we need to incorporate them throughout our day, whether it's at work, at home, playing with our kids, or in here at the gym. So we'll be glad that you learned them, and ultimately they can save you from pain in your later years. So the importance of primary goal of proper body mechanics is going to be to prevent those musculoskeletal disorders. Now, a lot of times people think musculoskeletal disorder is just neck and back pain. This is your carpal tunnel syndrome, your bursitis, also your herniated disc, your plantar fasciosis. A lot of people deal with that. Your rotator cuff tendonitis, as well as those headaches, back pain, all of that. It's important to evaluate our workstations or our repetitive movements throughout the day so that we can then recognize how we're doing them improperly and then properly assess them and change the way that we're doing them. So we need to redesign our tasks if necessary as well. So ultimately, it's easy to go throughout our days just slouching, glaring at the TV screen. How many of you feel like this? Right? I know. I do it too, and then I'm like, oh my gosh, Kevin was saying the other day, he's like, some days I go to correct my posture and I think it's just going to be right there, and then I'm like, oh my gosh, I was really that slouched. So true, it happens to all of us. So we must realize that we're doing them incorrectly and then properly apply the proper movements. So this is also, you know, that neck pain, low back pain, even numbness, tingling down the leg, that can all be from improper posture. It's even more important, obviously, in the CrossFit community, fitness community, gyms, lifting. We need to make sure that we're not sitting, standing, doing whatever we have to do throughout our days for 8 hours, right? Then you drive here, this is where we're at, right? Then you drive to the gym, and then you jump in here. If you're JR, you might be a few minutes late and you just jumped into that class. Then once you get here, you jump into the class, you start your warm-up, you do your lifts. Today it's a 1 rep max day, great, perfect. So you want your body to perform at this maximum potential. We're putting ourselves through these grueling workouts. After we just sat like this for 8 hours, That's when we get this pain, this discomfort. Also, those spinal disorders. Ultimately, if we compress our spine all day, love you, with this improper position and then lift, we're just putting ourselves in great danger. So a lot of times we lift well in here because we have the correction, we have the coaches that tell us how we need to do things, but it's up to us throughout the day to do things properly. So that's why I hope you guys take home that message today, ways that you can fix that. So, all right, so nobody wants a ruptured disc, right? Nobody. Nobody wants numbness and tingling. No one wants shoulder pain or bursitis. So we must do something to correct these issues before they happen. It is so much easier to prevent them than it is to get them better after we already have them. After you have those issues, they can get better, but usually that's going to be your weak spot. So a lot of patients that come in with herniated discs do go away, but it's always a weaker area. So if something's going to be aggravated, a lot of times it is going to be that specific disc level. There are studies, though, that show that disc can resorb, which is great, but if we continue to do the same movement patterns and we don't get that, and don't get anything taken care of, a lot of times that herniated disc will stick around. So I know that's a common misconception, I think, across the board. So also, we want to do those evaluations at work. I am willing to go to any of your workplaces, look at your standing position, your posture, your desk, how everything is set up. I will gladly go through that and change anything that needs assistance. So if you guys want that, obviously you can always contact me. But bottom line is, it's easier to perform our daily activities if we're pain-free. All right, so workstation setup. This is the static position of our work environment, and it must be adjusted to accommodate you. Static position is going to be the muscle or muscle groups staying in that same contracted position for an extended period of time. Ultimately, an important consideration is to make sure we're taking regular breaks. I often suggest people to set a timer on their phone, 30 to 45 minutes. To get up. So remember when you were in middle school or high school, we usually changed classes around 45 to 50 minutes. Now they have to block, and that just ruins my analogy here. So, but 45 minutes was usually max. That's spinal health, actually, in the working. So ultimately that made the kids get up, walk around, move around, change positions, work on structure unknowingly to them. So ultimately, you guys can do this. Also needs to be done not just at work. If we're out to dinner, watching a movie, standing in line at Busch Gardens, whatever it might be, we need to make sure we're constantly changing our structure, constantly moving, stretching, to get that pressure off. So, frequently used items at work must be easily accessible. Now, the reason is, I'm going to tell you guys a story here shortly too. The reason is because you are doing that repetitively, non-stop throughout the day. So, if you staple, say you use your stapler every 5 minutes for 7 hours throughout the day, but your stapler is way over here. You grab that, you sit up, you staple, you do whatever you need to. So ultimately, if you're grabbing that, you're putting unnecessary stress or strain onto the structure that might be, again, those cumulative traumas over time. Doesn't hurt that one time, but they might be causing the stress throughout that could eventually lead to spinal disorders. I recently did a library ergonomic setup for one of our local libraries in the county, and they had an L-shaped desk. So desk here and desk here. Her keyboard was here, her monitor was here, and then she was helping a customer here, and then her printer was back here. Did she bother to turn her chair because she was, not trying to waste time, trying to get her job done? No, she was doing this. So every time she had something printed, and this is a 50 to 60-year-old woman, so she's not a young kid just doing those twists. And then too, she said, I have all these right-sided issues. I wonder why that is. Well, we need to get everything centrally located so that everything can be upright and proper. All right, so the importance of maintaining a neutral lumbar spine. So we've been told since childhood that we need to stand up straight, sit up straight, make sure everything's up. And where do we see most of our kids nowadays? Right? Sitting down on their cell phones, just hunched over. You might be one too, I know I am sometimes. So ultimately though, we need to help to open up everything. So good body mechanics is based on good posture. Good posture is based on a neutral spine. A neutral spine helps to maximize our support, It helps to withstand the compressive forces, and it helps to lower our risk of ligamentous damage and disc herniations. Huge. Neutral spine. The coaches here talk about it all the time. So important. All right, so proper standing. Everybody stand up. So, go ahead. Okay, so this is a position. And make sure you can see. So this is going to be a position that needs to become second nature. You are going to feel so awkward right now because none of us stand properly. Okay, so you want to stand with your feet about hip width apart. Okay, everybody good? Everybody knows where your hips are, right? So you're going to tuck the pelvis in. So you're going to squeeze. So you're basically driving the pelvis down. You're going to engage your core. A lot of times when people do this, they instantly do this. So we're going to help to open up the shoulders, bring those shoulder blades back. Should be elevating through, and you're also going to pull the chin in and relax there.
Oh, relax.
Okay. Exactly. So ultimately, we don't want to have too much of a back arch. So we're pulling up. I want everybody to try to stand there for the next 5 seconds. Of course, you got it. Trained, right? Okay, so ultimately, your body should be using less. Right now, you feel like your muscles are engaging, and but this uses less energy to actually stand this way. You guys can relax however you're comfortable. Woo! Okay, so if you want to practice that, you can go ahead and sit down here. Go ahead and take a seat. Take a seat, grab a drink. Everyone's running for more drinks. It must be going better. Okay, so relevant in all aspects of our life. So it needs to be relevant at work, it needs to be relevant when we're at home, it needs to be relevant at the gym. Okay, so the standing ergonomics here. Ultimately, standing work, also including the bending, lifting, carrying, reaching, can be tough on the back, especially if those proper biomechanics aren't used. We want to avoid standing in a prolonged position for any amount of time past that 30-45 minutes. Again, setting that alarm, making sure you're checking and rechecking your posture throughout the day. Really important. Proper footwear, obviously we know, comfortable, supportive, something that's going to protect our ankles, it's going to affect our knees, affect our pelvis. Often stretch, beware of that posture, and make sure you're standing on a firm and level surface. A lot of the roads around here, if any of you run or walk, a lot of the roads that we have almost come down this way. So if you're running on one portion, a lot of times if I'm going like down cul-de-sac, I'll run down the center of the road or on the sidewalk. I don't run often, maybe for a glass of wine. But ultimately, I don't like when my pelvis is here. It hurts my ankles, it hurts my knees, I feel it. So make sure you guys are also paying attention to that. Something as simple as you think you're doing something good for your body, but in the end, if that surface is unlevel and we're walking or running on that surface, we're ultimately affecting the way that it's moving up into our structure. Okay, standing desks. Again, avoid the improper position for any prolonged time. I can't say it enough. Standing desks allow us to move more. Does anyone have a standing desk at work? Okay, and I know the county just purchased a few, so they've been trying them out too. So, but ultimately they do allow you to maintain a better posture and help to. Boy, do you want one?
I want one.
Oh, your boss will let you work. And help to improve circulation. With the standing desks, and this can go for standing for a prolonged period of time. If there's something, if you're doing dishes or cooking in the kitchen. Ultimately, alternating that foot placement, like we see this little lady here. I just don't like her neck, so don't look at her neck, just look at her feet. But we're varying the load, which is going to change the effect on the groin, buttock, and low back. Not that you're going to stand in that position again for that prolonged period of time, but just to kind of shift the weight through the pelvis so we can reduce some of the stress or tension there. Okay, so how many of you feel like this at the end of a long day? Right? Yeah. Okay. Ultimately, proper seated posture. Oh, can I steal a chair? I didn't even think about this. I'll take a chair. Okay, so I'm going to talk about this and then I'll perform it for you. Obviously, not on chairs. So, placing your buttock at the back of the seat while maintaining a small space between the back, your thigh and knee. So, basically, your knees should not be coming all the way up. Everybody see me here? Yeah. Okay, so as you sit down, you should have some space between the back of the knee and here. Now, obviously, your chair should be ergonomically designed. Obviously, some businesses, we don't have that opportunity. So, a lumbar support placed here can also push you forward. So if you're really petite and this space is so much longer than what you need it, go ahead and slide forward. Get a pillow or an ergonomic back chair so that you can slide that forward. A lot of chairs, though, will move forward so you can kind of fix that in the correct manner. Okay, so you want a little space here. Lumbar supports, a lot of lumbar supports that are built in are either too low or too high. I swear everything's made for a 6-foot person. Okay, so if you're under that, a lot of times, they're not going to be in the correct place. We want them to be in the small of your back. If they're down at your pelvis, you're pushed here. If they're up in your thoracic spine, you're pushed here. So we need to make sure that that lumbar support is nice and sitting in the small of your back. 90-90-90 rule is the part I want to really drive home today because most of us do not follow this rule. So 90 degrees at the knees, 90 degrees at the hips, and 90 degrees at the elbows. Okay, and you guys will have a picture here too. So sliding all the way back, space between 90 degrees, my shoes make me too high, 90 degrees, 90 degrees, and 90 degrees. Ultimately, if your desk is tall or you're really petite, that 90-90-90 is kind of difficult to reach. So you also want to have your feet flat on the floor. So if your desk requires you to raise your chair, place a footrest underneath your feet, and then that will allow you to get that 90-90-90. Now here it also says the thighs and the forearm need to be parallel to the floor. Well, duh, if we have the 90-90-90, they will be, right? Again, pulling the shoulder blades back, holding the chin, everything we talked about with the standing posture should also be happening when we're in that seated posture, okay? All right, so here's those images. So ultimately the standing desk, you can see the 90 degrees at the elbow here, standing nice posture, tucked in pelvis, engaged core, squeezed buttocks. Standing here, nice and ready to do your work. Seated, so we have the 90-90-90. 90 at the knees, 90 at the hips, and 90 at the elbows. You can see everything is properly ergonomic there. No need for a footrest because everything is in that position, proper position. Which is best? Right? On the left. Which one do you usually look like? Right. Yeah, I know, it's so terrible. Okay, doesn't she look like she's about to take off and run a sprint? Right? And that's how most of us are because our chairs are not set up properly for us. We sit at the edge, we think we have no time, but we need to have time for us. We need to have time to think about our structures because again, when that time comes that we want to work out, we don't want to be sitting like that for 8 hours. We want to get in here, have a healthy structure, healthy core, so that we're able to then do work, anything at our maximum potential. So ultimately too, has anybody ever heard of a Dowager's hump? Okay, you've seen one. It is that hump that's on the back of the upper part of the shoulders. Do you guys know what I'm talking about? A lot of times we see it more in our older women. Ultimately though, forward head carry pulls so much on that region that can actually pull that downward hump. Now sometimes it is hereditary. A lot of times you'll see a grandma, a mom, and then the child will get it. But what it is that increase in that kyphosis, ultimately, you can also have compression fractures dealing with that because it actually wedges that region. So as the osteoporosis sets in, as the osteopenia sets in, that all adds to that Dowager's hump. Okay, so laptop question. Can somebody raise their hand? Yes. And tell me what's wrong with A, with the laptop. Yeah, exactly. So the laptop is elevated, great for the head. So obviously this little person was being conscious of their neck and shoulders until they raised their arms to tighten. Okay? And then the second person, it's in their lap. So then they have this hunched over position. So we're getting it all up the back. And then the third one, which if you're working at a desk on a laptop, usually how it is, right there, carpal tunnel and epicondylitis. So that golfer's elbow, tennis elbow, because then you're here. Okay? Oftentimes what I recommend if a laptop is all that you have, use the laptop elevated so that you can see the screen. Get a Bluetooth keyboard. So then the keyboard can still be down here and then elevate that screen. Okay, who usually looks like the girl on the left? I know, right? Kevin goes, is that the same girl? It's not the same girl, but that is like easy. They're in the same outfit. But homegirl on the left is like most of us. So really, we want to be elevated. Okay, so proper sleeping posture. We spend about a third of our time, thank you husband, we spend about a third of our time in bed. So ultimately, we need to make sure that we are sleeping in proper positions, just as important as maintaining a neutral spine throughout the day. Making sure we're sleeping on a firm mattress, trying to stay off your stomach as much as possible. You have to think, if you sleep on your stomach, ultimately you have no structure except for your ribs that are supporting your body weight and your organs. So it's almost like your back begins to be able to make this bowing-like motion. If you're on your back, you have your entire structure to support. If you're on your side, you have your pelvis, your ribs, as well as your shoulders. So that stomach sleeping is the worst position to sleep in, so really try to make those changes. If you're on your back, pillow underneath the knees. If you're on your side, pillow between the knees. Now when I say pillow between the knees, not like a huge pillow. It only needs to be hip width apart to maintain that structure there. Alright, so proper lifting mechanics. Obviously we are more apt to lift properly in the gym than we are picking up that pen or piece of paper, dog's toys, laundry. How many of you notice half the time it's like here? I noticed this morning, because of course I was thinking about this, blow drying my hair. Does anybody flip over to blow dry their hair?
No.
Okay, girls, sorry. And ladies, usually when we flip over to blow dry our hair, we're here. There is nothing supporting that. So ultimately, we must train our spines outside the gym in order to be able to do the proper lifting in here. So the process of lifting places perhaps the greatest load on the lumbar spine, which makes it a high risk for injury. Proper lifting mechanics are a must. So make sure you're placing that load in front of you, bending those knees into that full lunge squat position, bringing the load towards your chest, assuming that neutral position with your back. How many of you have heard Kevin say, lock your back? I've heard it. So ultimately, we want to tighten those muscles, tighten in that proper neutral lumbar spine, lock, we're going to lift, and then we're going to straighten into that standing position with your legs. Okay, upper cross syndrome. Look around, who's got it going on right now? I know, did everybody just sit up straight? Okay, so what this looks like, we have a forward head carry with a rounded shoulder. So it's here. So the ears are in front of the shoulders are rounded forward. What this is a tight, over-facilitated pec muscle, and it's the tight upper trap or levator scap here. We have weak, deep neck flexors, and weak rhomboids, traps, and even a serratus muscle, which holds down your shoulder blades. Ultimately, with this musculoskeletal imbalance, we're more predisposed to neck injuries as well as shoulder injuries. So what do we do to fix that? Everybody gets to perform. Okay, so I want you to sit how you're sitting here, normal. We're going to start with a chin tuck. So ultimately, you're going to pretend like your chin is on a railroad track. It's going to stay parallel to the floor. You're going to drive that chin straight back. You should actually feel that your ears gently move towards your shoulders. You can do at the same time the shoulder squeeze. So you're pulling the shoulder blades back and tucking the chin. To me, it's actually relieving pressure. I can feel that I'm doing something, but it's almost more comfortable. Just make sure you're not choking yourself by trying to touch. Okay? I saw that. So you are creating a double chin, but it's more chin tuck double chin. It's nice, right? Woo. Okay, the stretches. So for those tight over-facilitated traps, those tight over-facilitated levator scaps. So I want everybody to sit up in that neutral spine. Go ahead and place your left arm behind your back. You're going to tilt your ear towards your right shoulder. You're going to grab at the top, sitting up really tall. So you want to be opening up those shoulders, because a lot of times we do these stretches and people are in the improper position. How many of you, now that you just sat up tall, are like, oh yeah, I've probably been stretching this wrong. So, okay, so gently holding. While you're there, go ahead and take the hand off. Look into the armpit. Gently pull the chin down towards your chest, and you should feel that in a completely different spot. Still, pulling that shoulder back, really opening the chest. It's not a stretch to where we're going into that abnormal spine. That one you should be feeling down through here. Is everybody feeling it there? Okay, let's equal out the other side. So go ahead, opposite way. Neutral lumbar spine. Go ahead and look into that armpit and gently pull down. Aware, remember this one is, it's like a cowboy hat, like, you know, like a CD cover, country music star. I don't know. Maybe Michael Jackson, I don't know. Okay, so upper cross exercises. Also, we do these with bands in here. You can do them at home. Imagine that, without bands. So what he has here is a towel that's rolled up, placed underneath his forehead, gives his nose room. Ultimately though, still the Y's, the I's, there's W's, everything to strengthen those proper muscles to get us out of that position. Again, stretching the pecs. So those are those tight over-facilitated muscles. Can be done in a doorway. Now these are those exercises that you guys signed up for. So you'll be getting them on the Have2Go website, which is where they're going to come from. They might go into your spam. So make sure you check for those by Monday, okay? And then too, the cool part about these exercises is they literally have a little video recorder. You just click on the video recorder, you'll actually, the models here will perform the exercise for you so you can check yourself, make sure you're doing it properly. So 90 degrees, elevated as well as lower, all opening up the chest, stretching out those tight over-facilitated pecs. Lower cross syndrome, bubble gut, bubble butt. That's all you need to remember, and that's all we need to get rid of. So bubble gut, bubble butt. We see people like this all day. Okay, so it's those weak abdominal muscles, weak glutes, tight over-facilitated erectors, and then tight hip flexors. One thing I want you guys to pay attention to, next time coaches have us do those stretches, either the ones where you do them up against the wall, you put your leg here and the mat's underneath, we're stretching out our hip flexors. But if your spine is here, you're not really stretching out your hip flexors. So you actually want to get that neutral spine and then try to bring your body up into that erect position. You'll actually feel a greater stretch there. Again, so it results in a forward pelvic tilt accompanied by knee pain and back pain usually. So some exercises, if any of you were at my first lecture way back when, a year ago, we went over the dead bug core exercise. Now ultimately, when you guys get these in your email, make sure that if you can't do step 1 properly, don't move on to step 2. So we could actually be causing more harm or training in the improper position. Abdominal raise, pelvic tilt. Can everybody lay down? Yes. Cool. So bend those knees up like we see the gentleman doing here on the top left. You're going to pull your belly button into your spine and you're going to squeeze your buttocks. You're not lifting your buttocks off the floor. You should actually have a relieving stress through that lower back. It should feel good. Yeah, right? So if you hold for about 10-15 seconds, you can do these in bed before you go to bed at night. Okay? So once you conquer that abdominal raise pelvic tilt, that needs to be performed in all of the rest of these exercises. Thank you. You guys can go ahead and sit. If you have to, right? What a gentleman. So ultimately, if you can't keep that spine down, don't move on to the rest of those exercises. Make sure you're doing them properly. It doesn't matter how much you lift. It doesn't matter how many of these you can do. If you can't do them properly, it's not worth it. Okay, so shear force. Who has heard any of the coaches here talk about shear force? Shearing. You're going to shear on your spine. I know Kevin said it. So ultimately, the 3 different forces here, you're going to have compression, tension, or shear. Shear in regards to the spine is one vertebra moving on top of the other. Where'd my guys go? I'm going to pass these guys around so you guys can see. Ultimately, when we have this shear, so if you push this forward, when one moves forward, ultimately that can cause canal stenosis. That can cause a closing down or a pinching onto the nerve because this intervertebral foramen, or the space that the nerve exits through, it closes down. Also disc herniation, so that shifting of space. So really important when they say lock the back, have that neutral spine. We're not placing that unnecessary shear force on the spine. Okay, some of these are really bad, so this is the progression of, so you might get one that already has a disc herniation and a lot of degeneration, but there's two that are semi-normal. Three. Maybe you need that one. You guys can kind of move around. They don't move too much, so let's see how that goes. Okay, so a fully flexed spine inactivates the back extensors. It loads the posterior tissues and results in that high shearing force. So if we're not keeping that in that neutral position, it pushes so much more unnecessary stress on the spine. Another important issue is going to be our nerves. This is our nerve chart, and there are goodie bags for everybody at the front. Make sure you get one before you leave. In there, it's going to have a spinal nerve chart. It talks about every different vertebral level, the nerves that exit through there, the areas that they innervate, and then some common effects that people experience whenever there's pressure on those nerves. Okay, so our body phone system. So our nerves carry the communication from our brain to all parts of our body by way of the spinal column. Think of it as a cell phone. So if there's good reception, ultimately you can hear the person on the other end. If there's bad reception, that call's either dropped or you're sitting there saying, Mom, Mom, Mom. Okay, so there's no connection through there. So when there's nerve interference, the communication gets dropped. The body parts and the organs can't hear what the brain wants it to do. So they don't respond with the 100% communication. So what causes this nerve interference? The dailiness of life. OSHA, Occupational Health and Safety Administration, states that by the age of 13, we have already experienced over 1,000 traumas to our spine. 13. Add in athletics, add in improper positioning, improper posture, and we can multiply that statistic. Lack of communication results in limitation of proper function, which leads to a decrease in our overall performance and an increase in the susceptibility to become injured or dead. What corrects this nerve interference? So the chiropractic adjustment helps to restore the proper balance between the spine extremities as well as the brain for that healing process. We want to reduce the nerve interference so that the brain doesn't have those dropped calls to our organs or structures. Ultimately, I want you guys to start paying attention to people's bodies. Publix is usually the best place. Walk behind some people, check them out. You'll usually see, you can see the skeleton here, lower right shoulder, lower left pelvis. That left pelvis goes lower, that femur turns in, lower leg, ankle, and knee issues. So you can see this on people. It's not surprising. You guys just start to look and notice that. Ultimately, motion put into the joints feeds the joints. Our discs don't have blood supply. So ultimately, we need to make sure that they're moving properly in order to function properly. It's never usually just one issue. We need to go to the source of the pain. We wouldn't put a Band-Aid over a splinter, so it just doesn't make sense. So wouldn't it be smarter to correct the issue rather than to always be masking the symptoms? Okay, so prevention and faster healing. Just two quotes here really quick. Sean Atkins, he's exercise physiology. I would estimate that 90% of world-class athletes use chiropractic on a regular basis, not only to prevent injuries and to improve their performance. And then down here, Dane O'Brien, I looked him up, I don't even know, it was a 96 maybe, decathlon winner. You obviously can't compete at your fullest if you're not in alignment, and your body can't heal. Your body can't heal if you're not in alignment. Every track and field athlete that I've ever met has seen a chiropractor in track and field. It's absolutely essential. They must be able to have that fast healing. They must be able to move. So why don't we want that for ourselves? Now, we know none of us, I'm not going to the Olympics. So We know that we aren't this, world-class athlete, but we want to live. We want to be our world-class athlete. We want to be our best version of ourselves. After that workout today, no random games. So ultimately, in an average year, 25 million people visit a doctor for injuries suffered as a result of athletics. $67 billion in each year is spent for the treatment of these athletic injuries. This is a crazy statistic. So sports injuries to youth now exceeds the occurrence of infectious disease. What are we doing wrong? These kids go into these athletics and they don't have proper positioning. Nobody's ever taught them how to stand, how to lift. And honestly, youth football, just for example, I know they get a rap a lot of times, but they're kids in helmets and pads just hitting each other. They don't have any proper structure to help to maintain their body positions as they're going through. They actually had, who was it? Oklahoma helmets, those helmets with the sensors inside to measure the amount of impact. I don't know where it was, but somebody purchased these helmets for their youth Little League team because their son was on the team and they wanted to see. They can generate as much force as the college students. Is that not crazy? Like, how is that? So, I don't know, it's what they came out with. So, injury prevention obviously needs to be one of our highest priorities. This is why we focus on our proper body mechanics and why we do this mobility, why we stretch, why we turn to chiropractic. We need to get our muscles, joints, ligaments, and tendons happy in order to have this properly functioning body. So the quality of healing is directly proportional to the function capability of the nervous system to send and receive these messages. So if we have this imbalance, whether it's muscular, structural, and these calls are getting dropped from the brain, we're having issues. We're not functioning properly. We're not healing properly. All right, so proper body mechanics, I'm back to my first one, so I must be getting done, okay. Proper body mechanics, vitally important to keeping our spine healthy, keeping our structure healthy, keeping us doing what we love, what we want to do every day. Really important, though, that we incorporate these proper body mechanic principles into our daily life. Get up, move, stretch, make sure we're concentrating on posture. Even if you are here for an hour or longer than what you should, do that positioning. It's not all as lost. So we need to make sure we're focusing on that position. Even if you hold that position for 30 seconds, that's more than what you did yesterday. So we need to gradually build on this. We want to avoid the prolonged static posture. Again, moving, stretching, all good stuff. Just to give you guys a little information about our office too, we're on Lakewood Ranch Boulevard, next to Ace Hardware in Canterbury Commons. We do chiropractic, we do massage therapy, acupuncture, all that good stuff. So everything is to treat the whole body. So, and my time's up, so thank you.